What is cerebral palsy? Cerebral means having to do with the brain. Palsy means weakness or problems with using the muscles. Cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. It is the most common motor disability in childhood. What are the symptoms of cerebral palsy? Early signs of cerebral palsy. In a baby younger than 6 months of age, head lags when you pick up with child while lying on the back, feels stiff or floppy. When held cradled in the arms, the baby seems to overextend his or her back and neck, constantly acting as if pushing away from you. When you picked up, the legs get stiff and they cross or scissor. In a baby older than 6 months of age, doesn't roll over in either direction, cannot bring hands together, reaches out with only one hand while keeping the other fisted. In a baby older than 10 months of age, crawls in a lopsided manner, pushing off with one hand and leg while dragging the opposite hand and leg, does not crawl on all fours. What are the causes of cerebral palsy? Cerebral palsy is caused by abnormal development of the brain or damage to the developing brain, which could happen before, during, or shortly after birth. Some of the things which could increase the risk of cerebral palsy are at birth, premature birth, low birth weight, infections during pregnancy, multiple births like twins and triplets, pregnancy complications. During birth, complicated labor and delivery, birth asphyxia. After birth, injuries to the head, infections which cause brain damage, problems with blood flow to the brain. Since the exact cause of cerebral palsy is unknown, it is difficult to prevent it. However, taking good care during pregnancy, birthing, and the first few weeks after birth can help reduce the risks. There are 4 main types of cerebral palsy. Number 1, spastic. This is the most common type of cerebral palsy. Too much muscle tone or tightness, stiff movements. Number 2, athetoid. Low muscle tone, movements are slow and uncontrolled. Number 3, atasic. Poor coordination, balance and depth perception. Number 4, mixed. Combination of symptoms are more than one type. What is the treatment of cerebral palsy? There is no cure for cerebral palsy, but treatment can improve the lives of those who have this condition. It is important to begin a treatment program as soon as possible. Common treatments include medication, surgery, braces, physical therapy, occupational therapy, and speech therapy.
Disclaimer: this information is not a substitute for professional medical advice, diagnosis, or treatment. Please consult a doctor for further advice.